Hi there, this is Dr. Paul and thank you for tuning into this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about how we actually get into the nitty-gritty of taking care of fillings and also, most importantly, avoiding teeth from being more susceptible to decay in the future. So let's talk about how we detect or diagnose decay. So there's something called the International Caries Detection and Assessment System. It's called the ICDAS. So basically how we grade decay in kids or in teeth of kids and adults is from a 0 to a 5 kind of score. So when we say 0, that means there is no decay. When we say 1, there is a slight decay on the surface of the tooth, which when there is saliva on that spot or there's water on that spot disappears. Number 2 is when the spot actually stays, whether it is wet with saliva or not. 3 and 4 is more definitive in that we can actually see little pits on the tooth, and more for 4 and 5 where the filling or the cavity is deeper and very close to the nerve of the tooth. So now that you know how we actually quantify decay, we can go over things we use in our dental office from, again, a staged care approach, which is the least extensive or the least complex to the more complex way of taking care of these cavities. So the first thing, of course, we do is something called a saliva or a spit check. So we use an agent that actually shows us how much of bacteria or the pathogen that causes decay, that kind of bacteria, is in your saliva. It also tells us what kind of pH or acidicity your saliva has, and also the consistency, if it's thick or if it's thin. After that, we can switch gears and talk about varnishes and lacquers. So varnishes and lacquers are agents that we employ to paint onto the surfaces of your tooth, which actually takes care of, through fluoride, takes care of preventing the bacteria to stick, or the pellicle first and then the bacteria to stick onto the tooth. The more new science or the more new literature actually tells us that using something called povidone iodine, painting that onto the tooth for 30 seconds, drying it, and then putting on the varnish or lacquers is even more effective. And if we do this every 3 months for kids or people with high decay risk, we can actually prevent cavities from starting, smooth surface or cavities on the smooth surfaces of your teeth from starting. Then we'll switch gears and talk about using high fluoride toothpastes as a day-to-day aid at home, brushing and flossing more, using special mouthwashes like chlorhexidine. So these are things we use for ICDAS 1 and 2, where things haven't gotten to the point of actual cavitation. Now, when you are in a situation when you actually have a cavity or a cavitation and the child will not let us do any definitive treatment, fear, a lack of trust, whatever have you, we actually use this special solution called SDF, so that's silver diamine fluoride. Now, silver diamine fluoride was invented in 1969 out of a PhD study in Japan, and in 2013, 16, and 17, it's gained more popularity in North America. In fact, it's been designated as a silver bullet for taking care of decay right now, and that's because of its property of using silver to kill a lot of the bacteria. So how this chemical actually works is it has almost 38% of fluoride built in, and it has silver ions. So the silver ions kill the bacteria. The high intensity fluoride actually arrests the cavity or arrests the decay. Now, this can only be done on teeth that are not sensitive as far as the nerve inside being infected or inflamed goes. So if you have a deep cavity and the tooth is already hurting you, then the SDF won't work in taking the infection away. But if you have a deep cavity which is deep enough to be of concern but not as extensive as where the child or the adult actually has an infection or a throbbing pain, then we can use the SDF to stop the cavity from progressing till the child can actually build more trust with the dentist, or the person can actually build more trust with the dentist, and we can do some definitive work. So we need to dry the tooth, we need to put this solution on, and we can only do 1 drop at a time, which means we can only fix 5 teeth at a time as far as putting on the SDF goes, because of the silver content and the potential lethal dose. And then we got to see this person back in 2 to 4 weeks to reassess that area, maybe add on another coating or work on the next couple of teeth, and then we need to see this person every 6 months to redo the chemical in case we're not doing a definitive restoration. So a prime example would be a really young child who has trust issues or who has issues with someone being in their personal space and having needles and drills in their mouth, or a person who's just waiting on the hospital to call them in for sedation dentistry. Then meeting this person every 6 months and painting on the same solution over the tooth will make sure that the tooth doesn't end up being in an infection or an abscess situation. So we're basically pressing the pause on the decay progressing further and further. So these are all the staged care approaches that our dental offices is utilizing, so that people don't end up getting into dental emergencies, people don't end up breaking the bank later on in life with crowns, bridges, root canals, implants, and things like that, because all the stuff is feasible if only the patient or the parent can understand the proactive approach us dentists are taking right now to make sure that you don't ever end up in being dire straits. I hope this makes sense, and if you have any doubts, 613-966-1225, or you can even send us an email and we can talk a little more in length of them. Thank you so much for watching.